Welcome to Adapt NCLEX Fundamental NCLEX Questions and Answers with practicing test-taking strategy. Let's get to it. I will read a question, you look at it, pause the video, see when you answer it, then you listen to me and see how I approach it so that you can see what you need to work on. Which prescription regarding, you see, I'm starting from the back. I will underline prescription. I know this can be medication, it can be anything. Regarding bathing, I have to pick a bathing answer choice. The novice nurse should anticipate. I need to anticipate that. A novice nurse is caring for a client who just had what? Perineal surgery. This is you. Perineal is lower in the pelvis. That means that area, we got to bath there. That's where we focus on. We're not doing bed bath. Bed bath is people who stay in bed, they cannot move. Sitz bath, yeah, you go through that area, the heat from the solution, numb the area, and take care of the infection. Sponge bath is the whole body, and tube bath is a therapeutic bath, where we put medication in the solution to take care of the whole body. It's not perineal. Number one is down. Number two, same thing. Read it from the back, underline buzzword, and put it together. Which action the novice nurse should do what? Take first, after removing the bed part. The novice nurse is caring for a client who is what? Bed-bound, debilitated client who had just had a bowel movement. Patient is bed-bound, had a bowel movement. You know he can't clean himself. Think about it. After you remove the bedpan, what is the first thing? Do you put him on the bed? You roll them on the side? Or what? Test-taking strategy. As soon as you take the pan, you already roll them. Your perineum is right in front of you. Provide perineal care. Cover the client with the top linen. This should not have been removed anyway. This is for privacy. Provide perineal care. What are you going to tell the doctor? You say, what? What am I going to do? Clean the patient. Reposition the patient on the bed? No, you got to clean the perineum before you put him down. So the best answer is number two. Number three, same strategy as we go. Underline the buzzword and see what you need to do. Select or apply. I know there's a bunch of answers. I don't need to pick all of them. I'll pick those that I'm confident. If there's only two, I pick them, right? Nurse provide care for a client with what? Xerostomia, right? This is dry mouth. That's all. Don't freak out. It's just dry mouth. Replace it with dry mouth. Which action is a priority when providing the oral care for this client? His mouth is already dry. Once again, his mouth is already dry. So what are you going to do? Rinse 4 to 6 times a day with the mouthwash. Mouthwash is very stingy, right? It has a lot of things in it. Astringent, that's what we call it. It has astringent feeling in it. It's going to burn the patient more. His mouth is already dry, so it's not good. Okay, 4 to 6 times is not enough either. Usually every 2 hours. Wear a sterile gloves during oral care. I know we worry about infection, but you don't need a sterile gloves. Provide oral care every 2 hours. Yes, this probably will get them out of the 24. They will get like 12 times a day. This is good. Clean 4 times a day with the water prick. Water prick has high pressure, right? This is high pressure, and that can cause more injury. We should not do that. And the 4 times a day is not enough. Apply lemon and glycerin using a sponge tip applicator. The sponge tip applicator is good, but lemon and glycerin will make you dry more, so we should not use it. Test-taking strategy, select and apply, only one answer, don't over-select, go for the buzzword and look for the areas that you need supposed to be in any part of the answer choice that is wrong will make the whole thing wrong. So number 3, is the only answer that is perfect. Okay. Number 4, NS provide care for a client with what's the same thing, xerostomia and acne. Now he has a dry mouth and then dry skin, whatever, everything is dry, and he has acne. Which action by the client, indicate teaching is effective? Select and apply. See if they're following the instruction. You know, acne problem, right? And they have xerostomia. If they have dry mouth, probably their skin may also be dry. So wash their face with the mild soap twice a day, right? Is that enough, right? Twice a day, is it enough? Ask yourself, wash their face with warm water at least 3 times a day, right? Postulates left untouched for spontaneous rupture. That means leave the postulates alone, let them rupture alone. Oil-based emollient apply to the face after washing, and water-based emollient apply to the face after washing. Water-based will lubricate the face. Oil-based will clog the acne and make it worsen. Pustules should be left alone and let them spontaneously rupture. Wash your face with warm water is better than cold water, at least 3 times a day. And you should not use a hard soap. So wash with a smart soap. So 1, 2, 3, and 5 are your right answer. Same thing. This question is a strategy to learn. You can use as a strategy. I will show you, right? Which stage of pressure, right? Also, the nurse should document based on the assessment. The nurse assessment showed what? Look at the buzzword. Partial thickness. Oh, it's not the full one. Loss involving what? Epidermis and dermis. So if this is the skin, this is the epidermis, there's a loss here, partial, and there's a loss in the dermis. It's not the full one. Therefore, and so far as there's a loss, which stage of pressure injury the nurse should document? So far as there's a loss, it can be stage 1, because stage 1, there's no loss. It's just a erythema hyperemia from the skin. 2 is partial. 3 is full. And 4, you see bone. Unstageable, that means you can't even stage. There's eschar over there. Test taking strategy. Once again, pause the video, answer it, and then you listen to what I have to say. Which position the nurse should avoid placing the client? That means don't pick that wrong answer. And then provide care for a client at higher risk of developing pressure ulcer. So patient is likely to develop pressure in ulcer. Which position should you avoid? The position you should avoid is position that will place a lot of weight on bony prominences, right? So if you put pressure on the face, prone, yeah, there's pressure in the face, there's pressure in the chin, there's pressure in the elbow and everything. But this is distributed along all those lines. Side laying, right? It's the same thing. There is a weight on the side, major part of the most of the weight is on your body weight, the other side of the weight. So only all the bony structure is now carrying your body all the way on the side. So this is the bad one. Okay. This is the baddest of all. There's no word for baddest, right? So this is what you should avoid. Position that majority of the body weight is borne by the greater trochanter. So all the weight is on your hips, basically. However, the body weight is so close to the surface that there's a minimum, you have a bunch of pressure on that area. The weight is directly over the prominence, and then it causes too much problem, right? Too much problem that you should not be using that on the patient at higher risk. If you put them on 30 degrees lateral, even though it's side laying, it's the best. So 30 degrees lateral position is the preferred position to prevent pressure ulcer, because it limits the body weight directly over body prominence. So it tilts them by 30 degrees versus the other position. So it's the best. Supine, yes, they still exposure to the rest of the body, but it's more distributed. So what am I saying? In the side laying position, the majority of the body weight is borne by the greater trochanter. That's the only one. It's taking all the pressure. The bone is close to the surface of the skin and it can get irritated, like you're laying on your side, your hip bone. But all other ones is distributed, especially 30 degrees. So if you want to lay them on the side, put them on 30 degrees lateral. So 2, you should avoid doing it at all. Don't you put them in that position. Number 7. So this is just to emphasize that since I did that question, I just follow it with that. Select or apply, and then place the client in the supine position who will need prolonged bed rest. That means he's going to be on bed rest for a long time. So he's on a supine position. Which areas the nurse should examine for pressure injury? Think about it. You're going to lay down for a long time. Which areas that you look? Yeah, the back of your head, occipitus, your scapula, right? At the back there. Your spine, straight, right? Your elbow, right? Your sacrum on your back area, and your heel on the floor. So all these areas you need to look. The good thing compared to side laying, this is distributed completely. So no one person is in trouble compared to side laying where the greater trochanter is in trouble. Number 8. A novice nurse is preparing to place a nasogastric tube for a client with small bowel obstruction. Patient has small bowel obstruction. Which position the nurse should place the client for and the procedure issue for the procedure? Guess what? NG tube, the best way is for you to be able to swallow. If you can swallow, I can place it where 0 degrees means you're completely flat. You can swallow when you're flat, right? 90 degrees is good. You're up like that. So you can swallow. You sit it up and you can swallow. 40 degrees is like that. Still cannot swallow properly. Even though supine is good, the degrees is very important. 90 degrees is the best way to allow a patient to place the NG tube in. So that's the best way to place an NG tube is 90 degrees. Place them in 90 degrees. A novice nurse is preparing to admit several clients. Okay. Which client needs standard precaution? Who needs standard precaution? And hygiene, washing your hands, right? Hepatitis A alone, and if you have no diaper, it's contact. If you diaper it, it's standard. HIV is not infectious by touching them, so it's standard precaution. You don't need to wear masks, you don't need to wear a gown unless you're touching the body fluid. Latent tuberculosis is also standard precaution. Infectious pneumoconiosis is caused by Epstein-Barr virus. It does not cause any contact airborne droplet. It's still standard. Lyme disease is also standard. All these patients need standard precaution. You should know this organism so that when you see it somewhere, you don't get trapped. And the last question. A novice nurse is preparing to perform dressing changes for a client with what 2nd-degree burn to the entire leg. Look at it. Your leg is all burned, right? You have burn wound over there. You are about to change dressing. This is painful procedure. This is strategy. Which action the nurse should perform first? Do you describe what the wound look like? Do you don sterile gloves? Do you give the patient medication? Do you gather your equipment? First thing, medicate them. Let them relax. Go gather your equipment, right? Then you take the dressing off, and then you change it. You wear clean gloves to remove the dressing, old dressing. We don some sterile gloves, and then change the dressing and document what you find. So number 3 is your best friend. Thank you for being a member. Take care of yourself. All the best of luck.